Lequita Brooks here. I am your social impact speaker and strategist. Welcome to Social Impact Sundays at 6, where we have massive social impact that leads to income. And today we have an amazing guest, Kristopher Sutter, for the social work movements segment. And this is the awesome thing about Kristopher is that he is a compassionate care social worker and advocate. He's going to tell us all about that. What is the difference between a medical social worker, a compassionate care social worker, and all the future things that he has in store for the medical profession, healthcare, all the things, and the impact that social workers can have, especially when it comes to individuals that have chronic illnesses? Because that's a point in our lives where we're very vulnerable. We just don't know what we don't know. And a lot of times none of us actually expect to have a chronic illness. So welcome, Kristopher.
Hi, Lequita. How are you?
I am doing great today. So I am so excited to share your expertise with our audience, what you have going on, and just what led you to this, I guess, being a compassionate care social worker. So tell me about your expertise and all the things.
Well, I've been a social worker since the year 2004. Been doing social work activities since around 2000. Got a master's degree in 2007, and have always worked mainly in the mental health field, but have also had my own experiences personally with chronic illness and friends and family that have chronic illness. And along the way, I've tried to develop strategies to help people manage chronic illness better in the medical system.
So yeah, and I think that that's the awesome thing about social work is that it's not just about our education and it's not just us having degrees and expertise, but sometimes it's also our life experiences that lead us
Mhm.
to where we're at. So tell me more about how do you differentiate like what you do as a compassionate care social worker versus the role of what we would say a traditional medical social worker is.
Well, you know, my experience with medical social workers is that they help clients with transitions, usually in the hospital, in a hospital setting, something like that, where they're helping with discharge planning, making sure that the person has the needs set up when they're at home or wherever they're going to go. Um, and they participate in treatment teams, but I find that they don't often have that much um, decision making capabilities on a treatment team within a hospital setting. So my goal is to try to empower them to have a larger role within a treatment team. Um, you know, I think social workers make up about 4% of the medical field. Think about that. Only 4% of everyone in healthcare is a social worker. Um, I would like to see that number way, way higher. I want to see that number be where they're thriving on treatment teams, where they're really part of the decision making process for that client. Um, I think too often clients, and this talking from personal experience, I remember I was in the hospital for a year straight once. Um, when I was there, I didn't get any counseling resources, no resources to uh, help me with what I was going through. Um, Family were not educated on things. The medical social workers I did encounter were so busy because they had hundreds of patients. Um, all they could do was really worry about Medicare, discharge planning, making sure you had your insurance lined up, and making sure that you got your supplies when you went home. But what if I would have had a social worker who was also there to give me counseling, someone who was there to provide support to my family, I think sometimes social workers in hospitals have that role when they're maybe on certain units within a hospital, um, like dementia units, perhaps, where they have that opportunity to provide care to the family. But I would just like to see social workers have a larger role in general in the medical field. The reason I don't consider myself a medical social worker is I've never actually done medical social work. Um, but I've had the experience of it. I have a lot of experience with hospitals and, personally and professionally, and the care that's provided. And I just want to improve the care that's provided for patients in those systems. So I consider myself a compassionate care social worker because I'm trying to educate mainly non-social workers because I feel that social workers usually have these qualities already, but I'm trying to educate doctors, nurses, hospital systems on how to actually um, make empathy the number one component of the care, to approach a person from a holistic perspective rather than, um, you know, this person has this disease, these are the medicines we're going to give them, and then we're shipping them out.
I love that. So bringing back the human elements of it.
Mm-hmm. Yep. I really just want to spread, the idea that if you treat people well, you will help them to understand their illnesses better. You can partner with them to reduce admissions, to improve communication with the providers, to improve clinical outcomes. I firmly believe that if you don't do those things, the outcomes will not be any better. Like people will stay sick, get worse, use more resources, tax the system. And frankly, I just think it's also the right thing to do. Like anyone who's been in a hospital, or I'll say this, any person I've seen who works in a hospital setting, they're different if they've had the experience of being in a hospital themselves. Any nurse that's been in a hospital will be a better nurse if they've also been in the hospital at some point in their life. So having that experience teaches them something about the importance of being a good person to another person. And I'm trying to draw that out of people and help them see the importance of being compassionate at all times, empathetic, understanding that the patient is going through something extremely difficult and partnering with them, trying to find whatever way they can to just improve the potential outcome for that patient.
Yeah, and I love how you talk about it from a very holistic standpoint. So it's not just about your health in itself, it's about your mental wellness, your emotional wellness. It's going to be about your environmental wellness.
Mhm.
Once you leave the hospital, it's about your physical wellness as a whole, like far as your eating, what type of exercise you're doing, if any. So all those things. So if you were talking to an executive at a medical facility right now, what would be some things that you would share with them in order to change this narrative of how medical social work is done and how individuals are treated, especially when they're dealing with chronic illnesses? What would you say to that executive?
My experience mostly has been that they focus a lot on numbers and they need to put faces to the numbers. They need to see how stressed the system is itself is, how stressed the providers are themselves in that system. Um, from a patient perspective, things are slow. It seems like if you go to an emergency room, pretty much anywhere in the US, you're going to be waiting probably a minimum of 2 hours. I'd say more like four usually, just to be seen. I think they have to understand that they need to provide some sort of comfort process along with the process of intake, just doing something to make sure that they know that you care about that person. There's also a lot of times where, personally being in the hospital a lot myself has led me to see the cracks in the system. And a lot of times there's just, you know, you have doctors from different medical groups coming in, and then you have nurses on the unit, and then, nutritionists from over here, or physical therapy from a different place, but no, they're not really cohesive. They're not really sure what the other person is doing, because a lot of times they're not putting the notes in until the end of the day, or so the people coming in don't know what the other person just did. So you get a lot of, the patient gets a lot of waiting and what's happening and who's doing what, and there's no real cohesive plan that can be seen. There just needs to be a better glue happening with the team, with the processes that are going on. I just know from a patient's perspective, a lot of times things seem chaotic, and you seem like you're the last person that matters. And you should be feeling confident throughout the entire time that what you're doing, what's happening to you, that everybody's on the same page. Everybody knows what their plan is with you, that you have a goal in mind. There have been times where I saw several doctors at the same time, and none of them knew what the other doctor was doing. And so it just delayed care by a few days until they could get together and contact each other. And sometimes as a patient, I had to facilitate that myself. Like one time I did a conference call. I snuck into the conference room, used the hospital phone, had all the doctors' numbers, called them, added them on a conference call, and got them all together by myself, doing it that way. And that's not something the patient should be doing, but it was a very stressful situation. And I just think there's so many ways that social workers can make an impact with patient care in a medical setting. And while I love nurses, and I think sometimes they don't have the knowledge necessary to be able to do the job.
So when it comes to nurses, they have their role of doing the medical stuff, and that's what they're great at doing. But far as the more human elements, you feel like social workers, since that's something that we're trained in, we're always talking about human and environment, self-determination, and things of that nature.
Yeah. And I feel like self-determination is something that's kind of missing from the medical lexicon right now. Patients should have some ability to direct their care, to make decisions, and not just have decisions made for them. I do think nurses are very compassionate, but it's in a limiting way, pain management, providing comfort when you're in pain, when you're in, stressful situations like that. But it's not necessarily driven for long-term outcomes for the patient.
Basically, the patient's complete well-being from leaving the hospital to their quality of life.
Even home health. Like, so I've had situations where I was, discharged home, and I had to get nutrition, right, through an IV. And the hospital, the nurse told me that this was going to happen. The social worker told me, the supplies would be there when I got home. And they said, a nurse would be there to train me when I got home. Problem is, none of that happened. I came home and the supplies weren't there. There was no home health agency set up for me yet. And I had, no one to train me. When the supplies did arrive, 16 hours later, I had to figure out how to give TPN to myself for the first time, by calling my insurance company and contacting a nurse through my insurance company's phone number. And she watched YouTube videos to figure it out and help me through the process. And if I wouldn't have got it, I would have had to go right back to the hospital because of dehydration. I think a lot of times a gap in just the coordination of services, because there's too many people doing the coordination. There's not there's not really a cohesiveness to the discharge plan. Like the social worker, I believe, conducts, make sure you're going home to a safe place. They see that the supplies are supposed to get there, but there's no follow through. Once you're out of that hospital, you're done. You're no longer their patient. So if you have a problem, what do they tell you? Go to the ER. So you don't have anyone to follow through to make sure you're getting what you need and that it's actually happening. That's another example where I think a social worker doing that kind of job would make sure things like that never happened. And I'm coming at this mostly from, I'm using my experience as a social worker, but my experience as a patient in the medical system is what led to this, because I just don't want to see other people go through the same things I've gone through. I've had 13 abdominal surgeries. I've had sepsis 7 times. And the amount of times I felt just forgotten by the medical system are too many to recall. And I don't think anyone would want themselves or anyone in their family to go through any kind of experience like that. And frankly, there's just ways to be better. And we should all demand it. The unfortunate reality of it all is, I think that as we continue to live longer, everyone at some point in their life is likely to experience a situation where they have to be in the hospital and they go through something that is difficult to manage. And I would like to see it that no one suffers. No one has to have that negative experience. And I believe if they added social workers who were working on these things, who had leadership positions within hospitals, these things would happen less and less, and we get closer to that goal.
Well, you have said so much today, Kristopher. I really thank you, appreciate you for shedding light on some of the gaps when it comes to improving the healthcare system, and especially how individuals who are experiencing chronic illnesses, so they can better navigate this process. And the fact that they shouldn't necessarily have to know how to navigate the process, because the system is already designed for them to be able to have the support they need,
Yeah,
the patient they need in order to move forward. So I just want to
that's a key, Lequita, for me, just especially just to end on that point, that I'm a social worker who has years and years of experience helping clients navigate the healthcare system, mental health systems. And if I didn't have that experience when I was a patient, I probably wouldn't be here now. Like, because it was me, I had to rely on myself to help me get through that. But, if it was my dad or my mom who's been trained to just say yes, thank you to the doctor, they would not have gotten through that. And I think there's a lot of people who just, because they don't have the knowledge, they're going to be at a disadvantage. I was lucky in that I have the knowledge to be able to navigate it, but most people, I don't think, have that background to be able to figure out how to do it. And I want to make sure that it's not reliant on the patient to provide that care for themselves.
Well said. I just want to thank you again, and thank you to our audience for joining us for Social Impact Sundays at 6. I am Lequita Brooks, your host and social impact speaker and strategist for speaking engagements. Make sure you go to booklequita.com. Until next time, you can have massive social impact and income. Have an amazing day.